Welcome to tutorial of superior muscles. Today we'll be talking about the muscles of the head, face, neck, shoulders, and arms. We'll begin with the muscles of the cranium, in particular those that cause any kind of facial expression. To begin with, we'll start looking at the aponeurosis, which is a general term for a sheet of tendon. This aponeurosis is also known as the epicranial aponeurosis. It attaches the occipitalis. We'll see the frontalis here. Both of those are involved in elevation of your eyes. So if we look at the action here, the origin will be the aponeurosis. So that is where the attachment site would be. And the insertion would be the skin of the eyebrows. Its action is to elevate the eyebrow and wrinkle the skin of the forehead. The next structure we have on our list is the Orbicularis Oculi. It's a circular muscle that surrounds the eye. The origin is the lacrimal bone, so this is what will anchor it, and the insertion would be all of the skin of the eye, including the eyelids. Its action is to close the eyelids, winking, blinking, squinting, anything involved in closing the eyelids. The Levator labii superioris. I had another one on the list, the Levator anguli. However, this one is very difficult to see on the model that we have in class, so I will be switching it up and using this one. It essentially causes the same action by lifting up the lips, particularly that of the corner. The Zygomaticus, there are actually two of them. We'll know them collectively as just simply the Zygomaticus, and they will take the corners of the mouth and lift it toward your zygomatic bone. The origin is your zygomatic, and the insertion is the corner of your mouth or lips. As the Risorius, its origin is the tissue of your cheeks. The insertion is the corner of your mouth or your lips, the skin. Collectively, these three muscles are involved in smiling. This one pulls the lips to the side, this one lifts it at an angle, and this one will lift it upward. The muscles of the mouth are known as the Orbicularis Oris. This is involved in closing of the mouth. So the origin are the bones of the maxilla just above your teeth, as well as the bone of mandible, again above your teeth, below your teeth this time. And the insertion is the lips and the skin. Its action is to pierce the lips together, as to protrude as if you were kissing, also to close the mouth. The Mentalis, its origin is just below your incisors on your mandible, and then the insertion would be your mental or your chin. So its action is to elevate your chin, and when it does that, it'll actually cause your lips to protrude as if you were pouting. Platysma here, its origin is the clavicle, as you can see here, and its insertion is your lower mandible all the way up to the mandibular angle and mental. And its action is to depress the angle of the mouth as if to open your jaw. Now, the muscles of mastication or chewing involve your temporalis, right here, and as well as your masseter. So the temporalis will lift your jaw, while the masseter will cause the clenching of your jaw, particularly in the back. So the temporalis, its origin is just below that aponeurosis. And the insertion is the ramus of your mandible. So that's this body part here. The mandible, it basically extends that whole length of the ramus. Its origin is just underneath your zygomatic bone, and its insertion is the angle of your mandible. Again, its action is to elevate the jaw and clench. Muscles of the cervical, basically your neck. So again, your platysma is involved in causing facial expressions such as opening up your mouth. I'm going to remove this, and that is our Sternocleidomastoid. The sternocleidomastoid has several actions. So together with the trapezius, it's going to allow you to flex your head laterally. So a lateral flexion allows for cervical flexion. So bringing your head down will also be involved in rotation, cervical rotation. Muscles of the pectoral girdle involved in stabilization. We'll break this up into two groups, shoulders and chest.
The shoulders are involved in elevation, depression, retraction, as if to roll your shoulders back and squeeze your scapula together, and lateral rotation, as if to turn your palms forward into anatomical position with your thumbs facing out to the sides.
There are several components to the trapezius. You have your superior-most component. Its attachment site is the base of your skull. External occipital protuberance would be the origin, as well as all along the spinous process of your vertebrae. The mid portion of the trapezius, the insertion is all along your scapular spine here. It allows for extension of your cranium, so it does the opposite of your platysma and your sternocleidomastoid, so they are antagonists of each other. And along with the sternocleidomastoid, it will also be involved in a lateral flexion of the cervical or your neck, and it will also be involved in elevation of your shoulder. This is involved in retraction. The lower part of your trapezius will be involved in depression. So if we think of this angle, it's going to bring it toward the bottom portion or the inferior portion of your thoracic vertebrae. The next component of your shoulders involved in retraction is your teres major. Its insertion is just below your lesser tubercle of your humerus. So that's its insertion, and its origin is the inferior portion of your scapula, is extension of the arm. So this is considered anterior flexion. And then when we bring it back, it's extension and then hyperextension to draw the arm all the way in back of you. Together with the pectoralis major, it will also bring your arm back down in an adduction. The last thing it works on is a medial rotation, so turning your arm inward. Now the teres major will work with the teres minor as well, which is just a bit deeper. And that would be right in there. The next set of pectoral girdle stabilization muscles are muscles of the chest. We have our deltoid, pectoralis major, and pectoralis minor. The deltoid, the origin is the acromion process of your scapula, and the insertion is your deltoid tuberosity of your humerus. There are actually 3 different origins. We also have the posterior aspect is the scapular spine, and then the anterior aspect is your clavicle. Collectively, their action is to abduct your arm. Medial rotation, so bringing the arm in toward the center. Your pectoralis major muscle, its origin is the clavicle as well as the sternum, and the insertion is right along the ridge just inferior to the greater tuberosity of your humerus. The action, it's involved in adduction, medial rotation, flexion, depression, and adduction laterally. Next we have the pectoralis minor, just deep to the pectoralis major. Its origin is the 3rd, 4th, and 5th rib. Its insertion, you can see, is the coracoid process of the scapula. Its action, protraction, so bringing your shoulder in, as well as you can see the action here, it turns yellow, so a depression of the shoulder, so it'll work with your pectoralis major. Muscles of the superior appendicular, beginning with your brachial or your upper arm. Your biceps brachii, bicep because it has two origins. Its origin is the coracoid process of your scapula, as well as the intertubercular groove of your humerus. The insertion is the radial tuberosity. Its action, one of the most common ones we know of, is flexion at the elbow, supination, turning your palms medially as if to face them toward the back. It is also involved in flexion of the whole arm. The lateral aspect, biceps brachii, will allow you to abduct your arm along with the deltoid muscle. Your brachialis is considered a synergistic muscle. It will help the actions of your biceps brachii. This is just deep to your biceps brachii. So if I remove this, you can see the brachialis. And its origin is on that just below the deltoid, so the deltoid tuberosity there. And its insertion will be at the coronoid process of your ulna. So this will be involved in flexion at your elbow. So where your biceps will attach or insert at your radius, the brachialis will insert at your ulna. So collectively they will hold on to both of your distal arm bones during a flexion. Looking posteriorly, we have our triceps brachii. Your tricep muscle has three origins. The first origin is the scapula. The second origin is along the posterior aspect of your humerus. And the last origin, your last origin is on the medial side of your humerus. So three origins, and all of them will collectively join right at the olecranon process of your ulna. The actions is involved in extension of the elbow, hyperextension of the arm, so also extension of your arm. Your antebrachial muscles I find to be the most complicated. There are so many little muscles involved in many actions, such as flexion and extension of your wrist, lateral and medial flexion, supination and pronation, so those are rotations of your antebrachial, as well as flexion and extension of your fingers. There are specialists who will work just on the muscles, nerves, and blood vessels of your hands. So today we'll go over a few, and I've thrown in some extras here, involved in pronation of your hand. So the first one is our Brachioradialis. Now technically this is going to be involved in flexing at the elbow. However, it is grabbing hold of your wrist while it does that. So as your upper arm muscles, your proximal muscles, are elevating and pulling at the proximal component of your lower arms, your brachioradialis.
So your brachioradialis acts as a synergist along with the biceps brachii to stabilize your wrist while you are flexing at the elbow.
This is an extra credit muscle to know, your Pronator Teres. It will be involved in pronation, or in other words, a medial rotation of your lower arm. There is another muscle also involved, and that's this guy right there, known as the Pronator quadratus. I'm also throwing that in as extra credit. The Flexor Carpi Radialis is a muscle that you need to know the insertion and origin. The origin is your medial epicondyle of the humerus. So the medial epicondyle, and the insertion is on your radial side here, just below your carpals at the metacarpal-carpal junction. The action is a wrist abduction and a wrist flexion. The other side of that is our Flexor Carpi Ulnaris. So we have our Brachioradialis, Flexor Carpi Radialis, and then we skip over a muscle, and the most medial muscle here is the Flexor Carpi Ulnaris. Very similar in action to the Flexor Carpi Radialis. It's involved in adduction this time, so it would be an antagonist of the Flexor Carpi Radialis, as well as a flexion of your wrist. If we remove some of these superficial muscles and look a little deeper, we have this muscle here, the Flexor digitorum superficialis. And again, this is deep to the Flexor Carpi Radialis and the Brachioradialis. It's involved in flexion of your digits or your fingers. Looking posteriorly, the last muscle to know on our list is the extensor digitorum longus. So it's this muscle here. This will be involved in abduction of your fingers, extension of your digits, as well as extension of your wrist.